Thanks for joining us, Dr. Crifasi.
Thank you for having me, Legal Fox.
Now, everyone in the world is familiar with the term COVID-19 now that it's become a pandemic. But what most people aren't as familiar with is whether the information they're receiving is accurate and factual and trustworthy, or whether it just might be a rumor or a myth. So we're happy to have you on today to clarify some of those aspects. So for prevention, most people know to wash their hands, but there seems to be a lot of changing recommendations about masks, wearing them, the different types. I've seen people in snorkeling gear, from something as simple as putting a plastic bag over their head. So what are some misconceptions about the different types of masks and their effectiveness?
Well, so the healthcare masks that we use, which are for professional usage, are going to be most commonly the N95 and then the surgical masks. A surgical mask, which is what you see a lot of people in the public actually wearing right now, are the ones that go behind your ears and they're pretty loose fitting on the side of your mouth. And those are more so literally for doing surgery so that you don't drop a beard hair off into a wound that you're trying to clean or anything of that nature. Whereas if you believe that somebody is sick, the N95 masks are going to protect you from breathing in a virus particle. And the other thing that we have to be mindful of is that if there's a particle in the air, it doesn't just mean that it can go in through our mouth and nose, but also into our eyes. And so healthcare workers will generally wear a shield over their face if they're dealing with coronavirus patients, because otherwise just wearing a mask is only half protecting them and doesn't make as much sense to do that. So for the people out in the public, if they are wanting to be cautious, the best thing to do is sanitize your hands and do a good job sanitizing your groceries or anything else that you pick up. Otherwise, they're probably getting some false reassurance by wearing the many different items I have seen for attempts at personal protection as well.
So how about reusing masks, because there is such a shortage, or sanitizing? Has there been any developments on that?
Well, that's another good question, and that's something that we've all been wondering. How often can we sanitize our masks or reuse them in some way? And is that going to be safe, and are they still going to be just as effective? So the CDC currently stands by some guidelines based on the studies that have been reviewed on it. And when it comes to the N95 masks, which are the ones that we use if we're going to be around a patient with the coronavirus, in addition to some eye shield or otherwise protection, we say so far that the best way to go about it is not to take your mask on and off. So anytime you take it to go and eat or to talk to somebody, that if you're going to use it continuously is the best way to do it, up to 8 hours. And otherwise, you can do that up to 5 times. And the way to make this last longer has been shown by a few different methods, but one of the most convenient ones is going to be by some UV light. There have actually been some nail salons who have donated some of their equipment where women who usually get their nails done use some UV light to harden their nails. And so people can do this with their mask in order to sanitize it without actually using the layman's term for sanitizer, which is a liquid or spray sanitizer, because that will actually break down the mask. And that's not something we want to do, because the point of wearing one is to have it be effective. And so it's up to 8 hours of continuous use, and then perhaps 5 times reusing it. That is the current consensus on how often you can reuse that and still protect yourself.
That's really interesting. I would have never thought that the nail salon dryers would actually benefit us in such a profound way. There's been many websites or people or other sources that have been circulating information about so-called natural remedies or prevention strategies for coronavirus. Do you think any of them might work?
The best way to prevent it is hand washing. The other things that we've heard from people are going to be people who wonder if you can gargle some water or try to kill it in your throat, is what I've heard about people saying. But that actually doesn't physiologically add up. And what I mean by that is that if the coronavirus particles are breathed into your throat, that means that they are attaching and going into your throat cells. And so there's nothing to wash off the surface of your throat because it's actually inside your cells. And your throat goes up to behind your nose and then also where your voice box is. So it's not just one little spot where you open your mouth and you see your throat. So from that particular remedy that I've seen circulating, I would say that is a rumor or a myth that you can, kill the coronavirus in your throat. And when it comes to pills or supplements or garlic or anything else like that, the best way to prevent succumbing from a disease or to a disease is going to be to stay in the best condition that you can in terms of your general health. And that's going to be for a basic healthy diet. That if you don't eat a healthy meal, then you can't just take a garlic pill and then be in a better state.
As an attorney, I had heard some things that are of particular concern in the legal community regarding sharing data, and that the government's thinking that if we're able to have some types of apps to track, so to speak, where people that actually tested positive for the coronavirus frequent it, that may help. Do you know of any other countries that have implemented something like that?
Absolutely. So in some other countries, it's actually mandatory to download the app, otherwise they'll fine you. And so it's something that I think we have to consider in terms of the privacy that we have here in America. Under what circumstances would we want to have a little bit less privacy, but perhaps more safety? I think that always protecting people's identity is important. However, one of the strategies in Hong Kong and in some of the other large cities has been to publish daily exactly where people were testing positive, where they went to the grocery store, where they ate. And so in some ways, I think that can empower people so that you know more than just people in my city are testing positive. And then you can be mindful, I think, in your decisions so that you have a bit more indication of what your true risk is going to be.
When we're thinking of people's privacies, their privacy interest, generally speaking, the law must be balanced against a compelling state interest and for the well-being of the citizens. And in this case, I think the government has a really strong argument. Now, you had alluded to other countries, so I was wondering if there's any other particular strategies or any place in particular where you think that they're employing a different technique that's of interest.
Yes, one country that is getting a lot of attention, positive and negative, for doing this strategy is going to be Sweden. And it's because they're doing something that no other countries are doing, which is bold and which obviously they're hoping is going to be the most effective strategy, but also carries some risk with it, which comes with any sort of change. And the strategy they're using is called they're hoping for herd immunity, HERD. And what that means is, like a herd of people or a herd of cattle, that they are allowing the coronavirus to circulate among healthy people. And this is in hopes that healthy people can get it and then get rid of the virus out of their system and then no longer be able to pick it up and transmit it to other people. And the way that they're doing this is they're specifically telling only people who are at risk or who are elderly to stay home and quarantined. And they're advising that people don't visit them in person as well. And so they're allowing their economy to stay open, their restaurants are open. They recommend their standard social distancing, but they haven't done a lockdown or any of those particular types of measures. And so far, they seem to be handling it. And it's going to remain to be seen over the next couple of weeks if their public can continue to follow those guidelines and really stay home if you're not in the best of health and keep your social distancing. And if that can actually work out for them, then that's something to really be mindful at in the future.
Excellent. Okay, I just wanted to kind of go over one of the points you mentioned that may be very important in general. So the fact that if someone had the coronavirus and at whatever severity they had it, is it accurate that once they have it, it cannot come back, or that if it comes back, it's just not as transmittable to others, or how does that work?
Yeah, so that's what we're currently thinking about the virus as well. And so we're going to be developing tests, and we already that let us know if you've had the coronavirus in the past. So the same thing goes for all of the childhood vaccines you had. I can tell you how good your immunity still is to measles, to mumps, to rubella. And so if, for example, you're exposed to some child who actually gets measles because they weren't vaccinated, you won't get measles from them, and then you won't be able to give measles to anybody else who you go and be around. And so that's currently the thought process for the coronavirus as well.
Well, that's actually a positive factor. Seems like Sweden has some interesting things going on. We'll have to maybe follow up and see how they're doing in a while with the practices that they have. So Dr. Crifasi, thank you so much for speaking with us and shedding light on so many important topics. We definitely respect your knowledge and the compassion that you have in helping your patients and the public in general.
Thank you for having me. Anytime you have any more questions or you would like to dispel some myths and rumor and truths, I'd be glad to come back.
Thank you. Ciao. So thanks everyone for tuning into part 1 of our series. Join us for part 2 of our series where we have Dr. Crifasi returning, and she'll be discussing important subjects such as rumors we've heard about popular medications, to ventilators, to just what we can expect in the future. Stay tuned.